All right. Welcome to the Bradenton Kiwanis. Sorry. I've got my phones here because my daughter is due today. She's in the hospital. She's dilated. Everything's moving along. So your grandpa, and it could happen. Well, I just keep checking my phone. So it could happen any second now. And you guys are going to be part of it if it does. So that'll be kind of fun. So with that, Ed, do you mind giving us our invocation?
Never mind. Father, we're thankful for today and the opportunity we have to gather together. We pray, Father, that as we are together, you will bless us as we listen to our county health official share information about a crisis that we've been dealing with now for far, far too long. We pray, Father, for our members that couldn't be here today. Some are ill. Help them to regain their strength. For those on vacation, keep your eye and protection upon them as they're gone. For Mike's daughter, Father, may you bless them as they get ready to bring us a blessing with this new person. We pray, Father, now that you'll bless our time together. For those that have eaten, those that are eating, and those who are about to eat, may you bless their food, and us to your service. And Christ will ask it in all these things. Amen.
All right. Well, thank you, Ed. Appreciate that. Our group is kind of small this morning. Doing the math, 3 times 5 plus 4.
You have 19.
Yes, sir. So, and it's probably because I don't think we've got a half hour's worth of material to get us through to when the program begins. So because of that, what I'd like to do is just kind of go through our regular agenda, which probably will take 10 minutes max. So we'll start with Mac and the announcements.
Okay, well, looking at our list, I don't see any outside guests at the moment, but if somebody pops in, I will be sure and let you know who they are. And I'd like to turn it over to Neil just to kind of give us a recap on the Meals on Wheels event that took place this last weekend and what we got coming up with the Kids Against Hunger.
All right, thanks, Mac. We had a great event this last week with Meals on Wheels. We were able to provide at least 400 families with approximately 12,000 meals for what we did. We packaged the sacks on Thursday and Friday, and then had the distribution event on Saturday. I want to thank all of those who were able to volunteer and help out. It was a fun time for all of us, and as well as the club put $25,000 toward this. Per Meals on Wheels, they've reached out and they do have matches that were provided to them, so they're going to be able to leverage this forward and have another event in October, and we'll be discussing whether we want to help volunteer in that regard. We'll do some more discussions on that and see if we can't get some more volunteers for another event in October, but we'll do that in a community service or a board meeting coming up. So thank you all for all your participation in that. Kids Against Hunger, we're going to have a line doing on Wednesday from 6 to 8. All volunteer slots have been filled, so thank you all for those who have signed up for that. On Saturday, September 19th, from 10 to 12, we have 2 open slots right now, and from 1 to 3, we have about 5 slots open. I have reached out to Key Club to see if they would like to fill any, but if you have the urge to help volunteer for the Kids Against Hunger packaging event, those are the opportunities that we have. We're going to finish those meals on October 3 with 2 sessions. All of those have been filled already by volunteers, so we don't need any more assistance on that. Keep in mind there is some coastal cleanup if you want to volunteer. See the newsletter on that. They have different Saturdays and other days that they're going to be cleaning up at different beach areas. So keep that in mind if that's something that you want to do. And then I want to turn it over to Alex if he's available to talk about any opportunities that the Satellite Club is currently doing. So Alex, if you want to share that.
Yeah, thank you, Neil. Sorry, I actually just pulled up where I was going, so I kept myself on mute and on no video, but I'll turn on right now because I'm now safe and parked. Yes, the satellite, or the club satellite, has a few projects going on. We've been trying to work on the Cortez Fish Preserve, help get it cleaned up and remove some invasive exotic plants. So we did one project this past Saturday. It went great. It was a nice small group, but there just wasn't enough time to promote it too much. I actually kind of made the decision to do it that day, the day before, so I really didn't promote it too much. But we're promoting for this coming up Thursday from 4 o'clock to 8 o'clock, 4 p.m. to 8 p.m. We're doing another cleanup project. We got a nice big 40-yard, I believe, 40-yard dumpster out there that we're trying to fill up with all invasive exotic plants, so like lemon pepper trees and carrot woods and things like that. Basically plants that have been brought into Florida that are taking over all our natural areas. So that project, like I said, is this coming Thursday from 4 p.m. to 8 p.m. and that's at the Cortez Fish Preserve. And then we're doing it again on Saturday morning from 9 a.m. to noon. So, and the goal is to try and just fill up that whole dumpster, try and just get out as many of these invasive exotic plants as we can, just to make it a better park, better area. So that's the only thing we have going on right now with the Satellite Club. But I also encourage anybody, if you're available, we are having our next satellite meeting tomorrow, Wednesday, 6 p.m. And this week's meeting is going to be at Three Keys Brewery. So we'd love to have more of you out there. So thanks a lot.
Okay, and I noticed we do have a guest with us. Let me introduce Jennifer Gerisi. I don't know whether I said that right, but Jennifer, would you like to introduce yourself, please?
Hi, everybody. My name is Jennifer Gerisi, and I work with United Way Suncoast.
Thank you very much. Appreciate you being here. Say hi to Bronwyn and the others when you see them.
I will.
All right, Mike, back to you, sir.
All right. I'd like to flip it over to Judge Smith for a moment of Kiwanis history.
We're still in 1936, and in early that year, leaders from Bradenton Chamber of Commerce and the Bradenton City Council approached the leaders of the Bradenton Kiwanis Club about the idea to build a trailer camp in Bradenton. It helped that leaders from the Chamber and the city were members of the club. As one of the leaders and future president of the Chamber, President Dan Blaylock Sr. knew that the Bradenton City Council had already rejected the ideas as not being feasible. With an economy still struggling, the city just could not afford to take on this project. The Chamber was convinced a trailer camp would attract tourists and new residents. In addition, it would create a subdivision for travelers to park their trailers instead of vacant lots around the community. After a long meeting with leaders of the Chamber and the city, Dan was convinced it was an interesting idea to present to the club for consideration. He met with the club's board of directors and there was a lot of discussion. Many people were still struggling from the poor economy and the club was continuing to raise money for the disadvantaged, especially children. Dan needed the board to unanimously support the idea if it was going to be successful. He especially needed the support of past president R.M. Bell, who had already proven his leadership in the club and community. Finally, after much debate, the board passed a motion to present the idea at the next meeting with the general membership. Believing that the idea would be passed, Dan went ahead and created a committee to move forward on a plan to build the trailer camp in Bradenton. He appointed his trusted friend and colleague, R.M. Bell, as the chairman, along with A.K. Hawkins, Worth Henson, past President Roy Roberts, and Dr. William D. Sugg as members of the committee. The group studied the issue and determined that a trailer camp would stimulate the economy for the city of Bradenton and create a well-rounded tourist program. On January 28, 1936, R.M. Bell appeared before the Bradenton City Council to encourage councilmen to consider the idea of a trailer camp just south of the city with the assurance that members of the club were behind them. Then on February 11th, at the club's regular luncheon meeting at the Dixie Grand Hotel, the club approved the project, and a panel led by Dan continued to discuss the plan to build a trailer camp in Bradenton. Participating in that discussion was a interesting international celebrity. Club member and manager of the Palace Theater, Harry Bato, had invited Sally Rand as a guest to join in the discussion with all these men. Sally, a burlesque performer, was famously known for her ostrich feather fan and balloon bubble dance, and was one of the most famous national personalities in America during this time. As expected, when Sally talked, all these men paid attention. After an extensive discussion, members of the club unanimously agreed to support the trailer camp and agreed to the language of a proposal to be presented to the Bradenton City Council. At that time, the Bradenton City Council was composed of John A. Singletary, L.A. Logue, Whitney Curry, and W.D. Corner, and Mayor Albert Sparks. After an afternoon of the Bradenton City Council, members of the club presented their proposal, which included the city leasing to the club a vacant 40-acre parcel of property on the Tamiami Trail. The address was 2310 14th Street and was an undeveloped parcel, was just a mile from downtown Bradenton. The rental payments to the city of Bradenton was proposed to be 25% of the net profits each year from the rental of the lot spaces, with initial plans set at 200 spaces. An important part of the proposal was that members of the club were encouraged when the city council asked members of the vote to render proposal in writing. That was encouragement. After the presentation, the council tabled the vote for a proposal for a special session to be held at 1:30 on Valentine's Day, February 14th, 1936. Now, after a full day working on this project, members of the club were ready for some well-deserved entertainment. That evening, Sally Rand and her company were performing at the Palace Theater in downtown Bradenton. Since she had just been at the luncheon meeting supporting the club's efforts to build a trailer camp, many of the members attended one of her performances. A number of the city council also attended. Sally and her company entertained the crowd with dancing, music, and singing. Everyone left happy and in a good mood. Next week, we will find out if the Bradenton City Council proposal to approve Bradenton Kiwanis Club's proposal to build a trailer camp has been approved, and that will set the stage for the beginning. We'll find out next week.
I don't know if I can wait till next week. Will you have any pictures of the performances in your archives? Muted.
There are plenty online, and for those of you that have been in the entertainment industry, I think there's a few online here in our group here. She was probably the most one of the most famous burlesque dancers at the time.
Notorious.
There will be pictures in the book.
Wow. That's crazy. Well, thank you, Gilbert. Now I'm going to turn it over to Sharon just for a few minutes. This is September. This all started, back in March. So 6 months into it nearly. And a lot of folks are working at home. A lot of folks are retired and just staying home. I think my dad literally has been out of the house one time and that was to get his flu shot. And that's in the last 6 months. So these are tough times for a lot of folks. And, as Kiwanians, as members of Kiwanis, it's important for us to reach out and see how each other is doing. And someone who is just taking this to heart and has done a fantastic job. And I mean, I can't say enough about Sharon. She is, she's just awesome. She's just the heart of the club. So I just want to turn it over to Sharon for a few minutes, and she can give us an update and kind of give us just a general feeling of how the folks are doing.
Sure. Thanks so much. In fact, we have a couple of the committee members. Really, my membership committee is very good this year. I feel very excited about all the different members that we have that are supporting membership. I mean, just as Mike indicated, it's very, very tough times. We're seeing some Kiwanis clubs actually dissolving, which is not a good thing. But what I think is amazing about our club is that we have virtual meetings that we can still see and talk to each other. I know it's sort of not exactly the same as being in person, but virtual is definitely a way to go. So what we've been doing is we took all of the members in the club, we divided it up into like a Google's Doc, and we've been making phone calls. So I've had the opportunity to talk to quite a few people, and if Jack's up for it, I think he's still on the call, see if he has any comments that he might want to make. But to me, it's been a very uplifting thing, because some of the members are saying that they're enjoying the Zoom meetings. They're enjoying the newsletter that Mac's putting together, because that's really the best way that we can communicate with people is through, in this case, technology. And if somebody's struggling with technology, we always have Mac who's available. And we've had some like help sessions behind the scenes to try to get everybody up to speed on it. So I feel encouraged that people are starting to adapt, to Zoom, but we're all looking for a way to actually be together personally. That's why I enjoyed volunteering this past week. I hadn't done anything really since the March time period, like what Mike was saying, but I really enjoyed getting together with other Kiwanis members again. That was a lot of fun at the food bank. I'm looking forward to doing the club satellite meeting with Alex and his crew, because we get to meet with them individually also. So there's lots of ways we can touch people. And why don't you think about maybe people like what Mike was mentioning, his father that hasn't had any connectivity other than a flu shot with somebody. Why don't you invite him to one of our Zoom meetings? It's very simple and easy to do. Have him, just be part of our club as a guest. That was one thing that we wanted to do with our membership committee, is have guests. So at any point in time, you can invite somebody to come and just be part of Bradenton Kiwanis, and then decide later on. Anything that you might want to add? Or are we out of time?
No, we've got time.
Yeah, I want to compliment Sharon on her leadership of the membership committee. She really does come up with some great ideas. She's doing a lot of research right now, but specifically in terms of talking to our members, I know I've enjoyed that a lot. Sometimes it's not easy to meet people, to get in touch, I should say. Some of our members now have new jobs, are working different hours, and it's not always the easiest thing to get with them. But when you do, boy, you really see that Kiwanis spirit come through. They're all very, very pleased with our Zoom meetings. Even those that can't attend regularly think it's a fantastic idea to stay in touch. I would typically ask about whether or not they attended any of the candidate forums. Some of them have and thought they were outstanding. Others were not able to attend, but knew about them and thought it was really a great thing for us to do for the community. I've also asked the ones I've talked with about their desire to come back to live meetings. And of course, that's not completely under our control. But I would say that the response on that is generally about 60-40, 60% would come back tomorrow if we were able to hold live meetings, as long as we were practicing proper protocol with distancing and masks and all of that. But about 40% say, this is working for us. We like where the club is, and we really want to be careful. And really, until there's a vaccine, we probably would not come back. So that's just kind of a rough estimate of from the people I've spoken to. But overall, I think the effort to reach out has been great. I haven't had one person say to me, geez, I'm really thinking of leaving the club. Not at all. I mean, in fact, everyone seems enthusiastic, and a number want to sign up for some of the outside service opportunities that we have. So the more we can do that, the better. But as far as I can tell from my survey, the club is holding together very well, and the things that we're doing are good and being appreciated.
Well, thanks, Jack. appreciate that, and Sharon as well. And I think that's a great idea. If you guys would like to invite someone to one of these meetings, they may appreciate that. Just for the camaraderie of it. I much prefer to see y'all in person, but just to be able to see you guys on the screen like the Partridge Family, that's cool too. So, well, Amy's here. Ooh, she just went away. All right, so I was going to have her. She had told us a great story in an email, story of a family that received some food.
She's still on the line.
Oh, is she?
Yeah. Amy?
I'm here.
There she is.
Hey there. We have just a couple of minutes. Would you mind kind of giving the group, telling them the story that you emailed to us about the family that kind of never thought they would be in the position they were in at the food pickup?
Sure. Hi, everyone. We had a food distribution for Meals on Wheels Plus and the Food Bank of Manatee that was made possible through support from Bradenton Kiwanis just this past Saturday. And we served over 400 families, which was spectacular. So thank you all very much for making that happen. I'm always very interested to hear from people who are willing to share their story with us as they're kind of waiting in line. And there was one car that I approached on Saturday, and there were two women in the car. It looked like maybe a mom and a daughter, although I don't know that for certain. But I just approached their car and asked if they'd be willing to tell me what the food they were receiving that day meant to them. And the mom said, to be honest with you, it means everything to us. They were a family of 5, and she went on to say that normally she referred to herself as a worker. She said, normally I'm a worker, but our family's in a position right now where my husband is the only one who's working. And, you know, with a family of 5 for the first time, we're finding ourselves below the poverty line. So, you know, we talk about these numbers of meals we're serving and food that's being provided, but I hope you all recognize that every single one of those means a lot to the families who have been impacted by COVID. I mean, I know we've all been impacted in different ways, but some families right now, they're just really hurting. They really need the support that's being provided through organizations like yours. So really and truly from the bottom of my heart, thank you. Thank you for making that possible. You know, think of that story times 400 families, and that is significant impact right here in Manatee County. So thank you all very much.
Thank you, Amy. That just makes it so real and so worthwhile. So we very much appreciate that. And we're at the top of the hour. So go down to your chat box and you'll see the link to take you to the Vimeo, where main program will be happening in just 1 minute. So we'll see you guys next week. Don't forget board meeting tomorrow, and have a great day.
Hopefully you, our viewers, will learn a whole bunch today. It's not just about what you may think that we're going to cover, but a lot about what the health department here in our own community does that people are unaware of. But of course, you know, in addition to saying thank you again for taking this time, our audience today, our viewers, and I'm sure the question you get all the time is, it's all about statistics lately. So can you share with our audience, what is the most up-to-date statistics you have for us?
Sure. Thank you first and foremost, Janene, for being here today. I wanted to learn more about public health and COVID-19 and also your flexibility. A lot going on, a lot of moving parts. And hello, everyone. I miss you all. Hope you're all doing well. So in terms of data, the Department of Health has a statewide website that you are welcome to view every day that gives you data by county. And as it relates to Manatee today, we currently have 10,932 cases in the county. Unfortunately, 275 deaths. And we have tested almost 25% of the population. Over 100,000 persons have been tested in Manatee County for COVID-19. So that speaks volumes. It's a team effort, and we continue to look at the data. We learn more and more every day about this novel virus.
You know, it came upon, I don't want to say suddenly. I know that you in the state of Florida were staying in tune to what was happening in other countries, and as it came, but how has COVID-19, what are some of the developments that your office has taken on and are working through right now?
Great question. So we were watching what was happening around the world and set up here what we call an IMT, Incident Management Team, even before the first case is in Florida, knowing full well that we would be responding to this virus. And we utilize the incident command system from the military for all types of disasters and events, even for planning of activities here in the health department. We always use the ICS structure. So we set up the incident management team, but unfortunately it took away about a third of our staff. We have about 100 staff here now. When I arrived here a decade ago, we had 150. So we have pulled quite a few staff to work on COVID full time. However, all of our services are still open, just kind of a skeleton crew as it relates to those other services we do provide. And fortunately, the state has given us funding to hire temporary employees to bring back 50 positions so that we can utilize them moving forward, as well as we hopefully can transition some of our staff who have been doing COVID response full time for the last 6 months to go back to their routine work here in the health department.
Now, you know, we talked about your team. You know, is all the testing actually done here, locally, right here on this particular campus? Do you partner with other organizations? How is, you know, what are some of the partnerships that you have developed because of COVID-19?
Great question. So the testing has been a little bit of a myth, the mystery, but to give you the history. So when the first cases occurred in Florida, this Florida Department of Health state laboratories, there's 3 of them. Ours is the Tampa lab. We're the ones doing the initial testing, and then they would send the test to the CDC for confirmation. After the numbers started increasing dramatically, then we started just utilizing the state lab, and then working with the doctors in the emergency rooms. They had the option, if they felt somebody maybe didn't meet the criteria, but nevertheless they felt it could be COVID, then they started using commercial labs. There are hundreds of commercial labs around the country that are being utilized right now to determine, and that's why some days we'll get a few cases and another day we'll get many more. It's because the data coming back, and all the data comes back into the state system called Merlin, so our epidemiologists got all that information. As it relates to local testing, so we do testing here. We go out, first we did the Bradenton Convention Center, the drive-through. Now we go to mobile home parks and hard-to-reach populations like the migrant workers. So we do what was called specimen collection and then send the specimens to the laboratories. We also have, in partnership with the state, the UTC site, which is now just being closed and is going to be moved somewhere else in Sarasota. We don't have a location yet. The Home Depot on Cortez just closed, but Lincoln Park in Palmetto is still available for testing, and they also do antigen testing, the rapid testing as well. Also, MCR has been phenomenal. They have done over 25,000 tests in Manatee County. So all of their sites, you can walk in and get a COVID test, and particularly for pediatric or those under 18, they have been doing all of those tests for us in the community.
Just for our audience sake, what is MCR? They may not be aware of the acronym.
So Manatee Rural Health Services was the former name. They now have changed to MCR, but they are the federally qualified health center in the county, one of the largest in the country. And we are so fortunate that they are here because they do a lot of what people think we do.
Okay, well, and it all comes back to partnerships. And so now I'm amazed. I've done some of my own research. You guys are like in charge of so much that I don't even think people realize how much that the health department here in Manatee County affects day to day. Can you talk to our audience about, nursing homes and how you have interacted, how you train, how you send people out?
Sure. So part of the COVID response obviously was watching the long-term care facilities, because those populations in there tend to be older and perhaps have underlying medical conditions. And we started seeing actually in 2 facilities an outbreak early on in March. And so ACA, the Agency for Healthcare Administration, a sister agency for the state, actually oversees those nursing homes. However, they don't have the presence that the health departments do being in every county. And so it was given to us the responsibility to go in there and assist with the infection control. And we're still doing that now. And actually 10 nurses from around the country were hired to come in and help just in Manatee County. We have over 70 facilities. And they have been meeting in this room actually every morning. They get their assignments on what facilities they're going to, get their PPE, their personal protective equipment, and then go to these facilities, help monitor the infection control, make sure that people are staying healthy. We have good communication with the hospitals, with EMS, and then come back at the end of the day, do a debrief, a report, and we follow up with them. We also have our school nurses, because once school closed in the spring, our school health nurses were available. And so every day they also reach out to leadership in all those facilities to find out, is there a new, what we call PUI, person under investigation, potentially for COVID? Do they need more PPE? What are the issues? For a while, until recently, they were being required to test all of their staff and their residents every 2 weeks. So helping with that as well. So a lot of communication, coordination, because again, we have that presence here in the community that some of the state agencies may have only regional assistance.
Talking about a person under investigation, specifically with the schools, are you helping the schools with contact tracing, not just the schools, but do you have a specific team? How do you handle tracing back so that people do know maybe that they've been exposed and we're unaware of it?
Great question. So as I mentioned earlier, all of the data comes to us. Every lab report comes to the health department, and it's based on the county where you live. So all of those come to us, and we obviously pull out the positives immediately. And we had two full-time epidemiologists before COVID. We now are up to about 10 epidemiologists and about 30 contact tracers. So the epidemiologists call, determine who the person has been in contact with, and then the tracers will follow up. Usually there's between 5 and 7 persons that the person has been around, or what facilities have you been to, large gatherings, that type of thing. And then we do the tracing and follow up, and then those persons are encouraged to be tested. And we also will go to the homes, our teams, for family members, for example, who are potentially exposed as well. So there's a lot going on behind the scenes as it relates to testing and trying to get to people as quickly as possible. So we even have access to databases to try to find out additional information. Obviously, everything is covered under HIPAA for privacy concerns, but it is really important. But people don't realize, I don't think, that that's what we do in public health. That's what we've been doing for decades, centuries. This actually is a list of the reportable conditions that we hope every physician in the state has on their desk. And anytime they diagnose a patient with one of these symptoms, they have to call us, and it tells us if you have to call immediately or within 24 to 48 hours. And then our epidemiologists work with the individuals to monitor the situation and try to control any potential outbreaks by doing, again, epi investigations and contact tracing.
So I hate to say that it's wonderful, but at least, there were protocols, there were processes already in place. It's just essentially the virus name or the virus type changed, but the people who have boots on the ground and have to follow some of these processes were already in place prior to.
Absolutely. It could be for tuberculosis, food poisoning, syphilis, the list goes on and on. We have disease investigators in the community. So yeah, this is the core of public health. That's what epidemiology is.
Yeah, talking about the core of health. Now, I remember as a child, I came here to get my shots before school started. is that something still that the health department does? Do you partner with somebody else? What are some of the divisions of the health department? We're learning today you're in charge of a lot more than I think any of us ever believed.
So that's, I think, those of us who are in public health, the reason why we love our work, because every day it's something different, and it's very broad. You're absolutely right. We do immunizations here, so if you're under 18 and you need any of the required ones, they're at no cost. But then we also have travel clinics for those going abroad. We have obviously the flu and all the other vaccines. Rabies, we do a lot of rabies, work with the hospitals on that. I think the misconception that people have about public health is that we are the clinic for the uninsured or underinsured. And actually, we don't do primary care. We haven't done primary care in Florida if there's someone else to do it for years. And fortunately, again, we have MCR, the Federally Qualified Health Center here. They do the majority of the primary care for the underserved population. So we specialize more. We do have clinics here, but it's, again, immunizations, tuberculosis, family planning, infectious diseases, STDs. And then also we have obviously environmental health. That's a huge program. So everything from monitoring the beaches, the pool, public pools, all the spills, red bags at all the medical facilities in the community. WIC is our largest program, Women, Infants, and Children. So that is for pregnant women and children up to age 5 who qualify, and that's nutritional information, breastfeeding classes, really trying to make those first 5 years as healthy as possible. We also do the vital statistics for the state, so any birth and death certificates. And that's probably one of the only places we make money in our health department. And I'm very proud to say we have a very good program here, and so you can do that electronically now as well. So people from around the state come to Manatee County for their certificates. But community health is tremendous, and that's where we do the community health assessment, the community health improvement plan, and we work through the Manatee Healthcare Alliance, all of our many partners in healthcare and business, to make sure we're looking at the health of the community. We currently rank 17th out of 67 counties in terms of health, so we could be better, and we worked and strive for that. We bring innovative ideas to the table. Community paramedicine came out of the Healthcare Alliance, and that's an extremely successful program. So again, working together, we have the Manatee Square Garden. Thank you, Kiwanis. That is our community garden here that our neighbors and our clients and staff use. And so those are the type of things that are truly public health. And if you stop and think, it really is amazing the amount of public health that people interact with on a daily basis without even realizing it.
I was going to ask you, what surprises people most about your job? But what surprised me most is, you'll have to better explain it, but you have the authority for involuntary, help me out.
Orders.
Involuntary orders. And so it almost like in that way you have, some major authority. Explain to our audience, what is involuntary orders?
So we operate under Florida Statute 381, and so that allows us to protect the health of the community. And at times there are people who have an infectious disease, whether it could be COVID, could be tuberculosis, who are spreading it knowingly. And so we work with our attorneys and the state surgeon general to develop that authority, work with law enforcement, and make sure that that person is quarantined, whether at home or if other measures are needed, to make sure that they don't spread infectious diseases in the community.
Which goes back to originally, how important it is for the physicians to let you know that some of these diseases and to follow the proper processes and protocols so that we can know that everybody is doing their part to keep our community healthy. You talked about environmental, so you talked about testing the beaches and stuff like that. Do you guys do air quality tests?
We don't. I believe years ago in public health we did in Florida, and we don't, but there are groups that will assist with us. We have contractors who we work with when we get those types of questions, also mold, for example, in facilities. So we'll work with them, but we don't have lead on that, if you will.
I just know because of California and the wildfires, that's on the people's minds of, you know.
But I will say, in that case, if there is something that affects the health of the community, asthma or something like that, you know, if the fires, then we would get involved from a messaging standpoint. But when it comes to a mold remediation in a house or a building, we don't do that, but we work with the persons who do. And one other thing that I think the misconception, I know I've asked this when we've done Jeopardy before at Kiwanis, but we're about the only state, if not the only state, where the health department does not inspect restaurants. So if there's a food outbreak at a restaurant, we get involved. We do, however, and this is again Florida law, inspect bars and places that have minor food, like a movie theater. So a lot going on behind the scenes.
You know, talking about that, do you know how many divisions is your particular, you know, I want to say company, but your operations here, how many different divisions do you have?
Well, I have a senior leadership team, so 8 members, so they then have their programs underneath them. So we also have accreditation. Communication is extremely important. So we have a communications director and all the messaging that goes with it. So yeah, and of course there's the infrastructure. So we can't operate a $10 million agency without having all those experts that take care of the finances and assist us. And then, you know, making sure the facilities are clean, making sure our vehicles are working. We obviously work very closely with the county. This is a county building you're in. We have a great relationship with Manatee County government, and I can't thank them enough. People think that we're employees of, and again, we're state employees under the Florida Department of Health, but we do have a dotted line relationship with Manatee County government.
It's phenomenal how many partners, communication, you're working right alongside, sometimes the lead, sometimes the support. What can you share about us? You know, I wanted to know, I've asked some Kiwanians, they didn't know. Does the health department help in burying John and Jane Does? You know, do we have a potter's field?
We get involved. Actually, the county government is more involved in that. They have lead on that. But when we used to have the TB hospital down in Lantana, that would be a situation if unfortunately the person passed away and they didn't have any income, then we would work with the county bringing the body back, and they would work on that. But I think another misconception people have is that we have lead on deaths, and obviously the medical examiner has lead, and that actually goes through law enforcement, Florida Department of Law Enforcement. So Dr. Vega is amazing. We work with him very closely. He has a building next door to us, so we see him often. And but again, we don't project any information about deaths.
So the morgue is not under your responsibility as the health department.
Right, it's county, and working with Dr. Vega.
So are there opportunities to volunteer with the health department?
Absolutely. As I mentioned, we are hiring 44 positions in the process of doing that right now. And you know, everyone from clerks to epidemiologists, logistics technicians, planners, finance experts. So really the whole gambit of the incident management structure, if you will. So yes, and also after 9/11, then President Bush put in place what's known as the Medical Reserve Corps, or the MRC, and it's a place where persons come to volunteer for disasters. They can be medical or non-medical, but it really is a way to vet persons ahead of time. They're screened, they're given appropriate training, and they have a chance to respond. So if it's the Blues Fest or anything that's happening in our community during peacetime or blue skies, it's an opportunity for them to go out, work along EMS and fire, and get that experience. And then during disasters like hurricanes or wildfires, when we had the Callahan Tire fire, our team was there to assist the firefighters as they were having issues there with their health. Yes, there's many ways to volunteer.
Okay. What's your greatest need as the director here? What's the greatest need of the health department right now?
More support financially, staffing wise. We really, as I said, in the last decade have as an agency across the state lost about 1/3 of our team, and you can see during times like this how vital public health is. And again, we do this every day, but not to this capacity. And so being able to be even more proactive when COVID's over, but continue to be able to do more HIV screenings. We do that, but we have to divide our time between the jail and the community. If we had more people, we could be doing more and improving the health of the community and move us up, hopefully, in our rankings as well. So I think as horrible as COVID-19 is, I believe it's been an opportunity for most people to say, oh, I now have a little bit better understanding about the role of public health in our society. And hopefully that will continue.
I think that taking the time to learn during the pandemic definitely will help us as individuals with mental health. Talking about mental health, do you have any direct services here? Do you partner with somebody else? What is the health department's role? Because I know you do have a couple of clinics.
Right. We don't do mental health. Fortunately, we have Centerstone and other providers in the community. However, if during a disaster or after a disaster, if there is a need in the community for crisis response, then that is our responsibility to bring those experts in. But we're getting more involved. The opioid issue really brought a lot to the forefront in our community, and so we were very fortunate to receive some CDC grants because our numbers were so high in the community, particularly fentanyl deaths. And so through public health, we were able to receive funding from the CDC, and we're able to do some really important programs. But we don't do that alone. We work together and determine which pieces of the puzzle. Also, right before COVID started, we were able to pass the needle exchange program here in Manatee. We were one of the first counties. And so we were doing a lot of that work as in terms of the administrative pieces of it. But again, a lot of the partners will be the providers in assisting us when we do get that off the ground.
I can't imagine your directory of partners. It must be phenomenal. And it seems like you really can reach out to people with specific skill sets. And so you're relying on everybody to be the best that they can be in their particular areas, which just means better, moving forward for our community, because we have those resources available to us. You started sharing with us about your job. You've been here over 10 years, is that correct?
I've been with the state 25 years, but in this position, over 10. Mm-hmm.
And what can you share, what are, the greatest successes over the last 10 years you're proud of here in Manatee County in regards to the health department?
Well, obviously my staff, we're like family, and I'm just so proud of them. People are so dedicated here, and that's, again, the passion of public health. So I really, kudos to them. They don't get enough credit because they're always working behind the scenes. And people say if you're doing a good job in public health, people don't see it because you're making sure that there aren't crises occurring. So first and foremost, having that team around you. And someone once told me, you can't be an expert in everything, so you have to surround yourself. And obviously that's true in public health because it's so broad and so diverse. So being fortunate to have those individuals around me, my leadership team, my next team of supervisors, and then the entire agency working together to make sure that we're making a difference every day.
I know that as our community grows and the numbers grow of just our population, possibilities of different types of outbreaks moving forward, now moving into flu season, and I'm sure you're recommending making sure everybody gets their flu shots.
Absolutely, as soon as possible, because when a vaccine does arrive, and we're already starting to plan for that, we have a work group working on how that distribution will occur. We want to make sure that if there are any side effects, and hopefully there won't be, but if there are, we need to make sure that you're only getting the flu vaccine at one time early enough so everything clears, and then the COVID vaccine so that we can not give them together and have confusion about what's causing what. So please get your flu shot as early as possible. It'll boost your immune system in general and hopefully protect you from
I guess that would be what we would call the PSA for today. Please get your flu shot and get it soon.
Absolutely.
I didn't want to take up your full lunch. We again appreciate you taking time to do this, but what can you share with us that you may believe that somebody has on their mind right now that I didn't ask?
Well, I think there's a lot. The long-term care facilities, that's something we talked about, but now that they're open, we want you to see your loved ones. Absolutely. All of us have that experience where we know someone in a nursing home, assisted living, but please take proper precautions, because that's one area we're really concerned about, where those numbers could spike again. And again, the partnerships, like you said, whether it's the hospitals, EMS, the chamber, getting the masks out. We did Mask Up Manatee. I don't know how the commissioners just voted, but regardless, I hope that you still wear your mask in public. The social distancing is really important as well. We're learning more about this virus every day. It's a novel virus. It's new, less than a year old. We will continue to learn about it. So please, I encourage you to take those proper precautions and make sure that you protect yourself and also protect everyone around you.
I know that it's so important that, this is definitely something where neighbor to neighbor can help each other. I know that it's important to check on your friends, to reach out to make sure that people have what they need. Is there a hotline that people can call just for information if they have questions? Not all of our elderly people may be technologically inclined. So is just the general phone number to the health department going to get them some frequently asked question answers?
Actually, it's 311 in the county, and we work very closely with the county team there, and they're taking the questions now as it relates to COVID or anything else and that people have questions about in the community.
Well, hopefully some of our viewers didn't even realize, some people know 911, and then we got 411, and now we got 311.
Absolutely.
So 311 for your health questions.
And general questions, yes, about the counties. Absolutely.
Okay. So Dr. Bencie, in your thinking over the next 30 days, the flu coming in, and now we're in hurricane season and everything else. If you could tell our audience, what are the top two things, other than getting their flu vaccine, what are the next two things they should prepare for? What should everybody right now be sensitive to from a health perspective of the community?
Well, that's a great question, because as you can see, we didn't know that COVID was coming a year ago, right? So every day is a different day, a new day in public health. But I think you have to be prepared all the time. And prevention is really the key in public health. So anything that you can do to keep yourself healthier is going to protect you against disease, but also, in this case, protect others as well. So take time for yourself, whether it's physical health, mental health. We're all in this together. We do live in a close society at the end of the day, but you really have to make sure that you take time and avoid the cigarettes. That's probably the old saying in public health that's still true today. The vaping, looking at that, that's something that we keep a close eye on as well. But just taking care of yourself really will help you build your immune system. Get that sleep. Not too much alcohol or chocolate.
Okay. And she said chocolate for all of those. She just said not too much. She didn't say none at all. We're coming to our 30-minute mark, and again, I want to thank you. I want to thank our viewers. I know this has been more like a conversation. My apologies for not speaking directly to our viewers today, but I hope that you've learned a lot about the health department. I hope that you heard something that you want to learn more about or get involved in. Key is they do need volunteers, and they're looking for people to come alongside them in partnerships. So, we hope that you have today found something new that you might want to learn more about and come alongside Dr. Bencie and her team, firefighting, wildfires, preparing for disaster. each of us, like she said, can do our part to make our community, rise up for the community's health in regards to the overall state. Again, thank you to your team who worked with us in getting on site and making sure that we were all set up. And we look forward to, we normally hear from you about once a year, so hopefully next year you're giving us great statistics about the vaccine for COVID-19, as well as, other successes our community has seen, and hopefully we've gone up a couple of notches in the overall success of our health in Manatee County.
That's definitely our goal.
So thank you to Shin Productions for streaming this to Vimeo, and thank you to all of our Kiwanians who are watching this. Remember, the recording will be posted this afternoon. Please share this with your friends. We want to get out the word about more about our community, the resources of our community, and what we support as a county all together. So thank you and have a great afternoon.